Hello, welcome to yet another live session. I am Dr. Nilesh Balkawade, Clinical Head, Oaisis Fertility, Pune. Today, we are going to talk about what are the tests which we need to do before going for IVF. Friends, IVF is considered as one of the treatments for infertility. IVF or in vitro fertilization is a procedure of assisted reproductive technology where we prepare the embryo outside the body, we grow it for some days, we may or may not freeze it and then we transfer it back to the body. Although the preparation and the growth of the embryo is outside, the course of pregnancy almost takes the same course as a natural pregnancy. But friends, whenever we are going for IVF, we need to do certain tests so that we are sure that our IVF attempt is successful in the first go, preferably, or it should be having a maximum success rate. And therefore, we are going to talk about these tests. So, in a man, before we are going for IVF, a good physical examination is necessary to rule out certain infections, certain problems with the testis. If there is a problem with the semen analysis, we need to find the problem with the semen analysis. Count, motility, and morphology of the sperms needs to be assessed. If there is any problem with the count, motility, or morphology, which we call as oligospermia, asthernospermia, or teratospermia, in any of these situations, we need to do further tests to evaluate the problem. In certain individuals, we can do hormonal assay. In certain men, we can do ultrasound of the scrotum and the Doppler. And in men who had a history of previous IUI failures, history of previous recurrent pregnancy losses, and history of previous IVF failures, we would also like to do sperm DNA fragmentation index before we go in for IVF. Along with that, we need to check for some viral markers to look for any infections, whether they are present or not. This may be related to sexually transmitted infections. In women, we need to evaluate the patient for her routine investigations in the form of complete blood count. We need to check whether hemoglobin levels are good and whether she is fit to go for pregnancy. We need to evaluate certain common disorders which are present in the Indian population, like diabetes mellitus. So we can do the blood sugar levels, the fasting or random levels. If she has a history of family history of diabetes mellitus, in those patients we can do HbA1c levels or glucose challenge test. Along with that, we need to check the patient's blood pressure. We need to do a routine examination of that woman before we go ahead. So a gynecological examination is must before we proceed for IVF. The examination of the vagina, cervix, local genitalia, the examination of uterus is very important, and the assessment of uterine length by uterine sounding can also help us during the treatment as well. Along with that, as we discussed, that the routine investigations are important, the complete blood count, the blood sugar levels, the hormonal assay is important. So the thyroid levels, prolactin levels, and what is the ovarian function like can be assessed by either ovarian reserve tests or ovarian function tests. Ovarian reserve can be assessed by two simple tests. One is the serum AMH levels and the second is antral follicle count assessment on ultrasonography, which can be done in the menstrual phase of the woman. Along with this, the patient needs to be assessed for the uterine volume, the uterine size, the uterine shape, and any problems with the uterus before we go in for IVF. So if there are any problems with the uterine shape or if there are certain disorders like adenomyosis, fibroids, these can affect your IVF success and therefore they need to be corrected first. Also, the assessment of fallopian tubes to look for any hydrosulfinges may be necessary, and therefore a good ultrasonography or a HSG can help you to diagnose that. If you diagnose some problems with the fallopian tube such as hydrosulfing, that needs to be treated first before the patient goes in for IVF. The uterus assessment will also include the uterine volume. It also includes the endometrial volume, the endometrial thickness, its vascularity, which is very important to define the IVF success. If any patient has had a history of previous miscarriages, then certain special tests also need to be done before going in for IVF. These include genetic testing of the couple so that a genetic testing of the embryo can be planned during IVF. If there is any history of any certain losses because of thrombophilic disorder, certain tests related to that can be done. Friends, IVF has to be a methodical process, and therefore, before going into IVF, we need to test the man and the woman so that we can plan the IVF in a proper way. IVF cannot be a routine or a same procedure for all the patients. One shoe cannot fit for all. In the same way, we should have the standard individualized protocol for each patient, and this individualization can be achieved by the tests which we do initially. So this is about the test for IVF. If you have any query, please connect to us at Oaisis Fertility, or please log on or call on to the helpline number which is shown below. Thank you so much.